Let's talk about the classical indications of Yin Wei Mai or Yin Linking Vessel. Chapter 41 of the Simple Question says, in backache caused by the Fei-Yang channel, the pain travels upwards gradually with a feeling of sadness. If the pain becomes severe, the patient has a feeling of fear. To treat this pain, use the Fei-Yang channel and needle the point 5 Zun above the internal malleolus, which connects with the Yin Linking Vessel, that is, kidney 9. Chapter 29 of the Classic of Difficulties says, when the Yin linking vessel is diseased, there is heart pain and depression. The same chapter says, the Yang linking vessels links all the Yang. The Yin linking vessel links all the Yin. When Yin and Yang cannot link with each other, there will be pensiveness, obsession, loss of willpower, and lack of self-control. The Golden Mirror of Medicine lists the following symptoms for the Yin linking vessel: feeling of fullness, stuffiness, and distension of the chest, borborygmi, diarrhea, anal prolapse, difficulty in swallowing, diaphragm stagnation from excessive consumption of alcohol, hard lumps to the side of the hypochondrium, hypochondrial and heart pain in women, internal urgency, abdominal pain, unresolved attack of wind cold that leaves a tightness in the chest, malaria. Classical indications for the Yin linking vessel. According to Simple Questions, backache with pain traveling upwards gradually with a feeling of sadness. If the pain becomes severe, the patient has a feeling of fear. From the Classic of Difficulties, there will be heart pain and depression, pensiveness, obsession, loss of willpower, and lack of self-control. From the Golden Mirror of Medicine, feeling of fullness, stuffiness, and distension of the chest, borborygmi, diarrhea, anal prolapse, difficulty in swallowing, diaphragm stagnation from excessive consumption of alcohol, hard lumps to the side of the hypochondrium, hypochondrial and heart pain in women, internal urgency, abdominal pain, unresolved attack of wind cold that leaves a tightness in the chest, and malaria. Case history. We have a woman of 54 suffering from severe anxiety and claustrophobia. She was afraid to go to the theater, church, or in the underground. She was anxious when alone at home and felt a tight gripping sensation in the chest. Her pulse was choppy and her tongue pale, but with a red tip. Clinical manifestations were due to deficiency of blood, depriving the mind of its residence and resulting in severe anxiety. Due to deficiency of blood and the typical sensation of tightness in the chest, the Yin linking vessel was used, P6 on the right and spleen 4 on the left, producing excellent results. Function of Yin Wei Mai circulates Jing, Yin Qi, and Wei Qi in the thorax and heart. It regulates the kidney-heart axis and calms the mind. The Yin Wei Mai connects all yin channels. Yin deficiency will cause a deficient Yin Wei Mai. Symptoms: pain in the heart, tightness in chest, depression, fear, panic attacks, restlessness, postnatal depression. Palpation of the scalene muscles and the origin of the sternocleidomastoid muscle. Point pair, we have the confluent point, PC6, Chong Mai, coupled point, spleen 4, Chong Mai, confluent point. Disease patterns. The following Zhangfu disease patterns can appear similar to a Yin Wei Mai problem and have to be properly differentiated. Heart fire, heart qi stagnation, disturbance in kidney-heart axis. Heart fire can be a result and further complication of heart yin deficiency. Cardinal symptoms: palpitations with heat sensation, hectic unrest and restlessness, ulcers in the mouth, tongue ulcers, stomatitis, fast speaking, endless talking, and aversion to heat. Stagnation of heart qi causes the qi to stagnate in the thorax. Cardinal symptoms: palpitations, feelings of constriction in the thorax, depression with a feeling of oppression, unable to express emotions. Kidney and heart represent yin and yang. The heart is located in the upper burner and the kidneys are in the lower burner. Physiologically, the heart connects with the lower burner through the kidneys, and the kidneys connect with the upper burner through the heart. The two organs are interdependent and counterbalance each other. The kidneys send water, or yin, to the heart to cool the heart fire, the yang. The heart sends fire, yang, to the kidneys to warm the kidney water, yin. Kidney yin is very important for the yin in the entire body. Heart requires the yin of the kidney in order to be able to house the spirit. Because the kidneys have more yin and little yang, and the heart has more yang and little yin, the interaction of heart and kidney is important to root the spirit.